Doctor, you didn't start out in this field looking to treat patients. I've read some interviews and things like that. Can you just talk about how things evolved into doing what you're doing now?
Yeah, I was actually interested in basic science research, and I
Mm-hmm.
chose to go to medical school at Cornell because Sloan Kettering, which is the great U.S. cancer hospital, was associated with Cornell, and I went there. And my goal was to spend the rest of my life in basic science research at Cornell and at Sloan Kettering, not even deal with patients except in a research setting. And at the end of my second year of medical school, my mentor, Robert Good, who at that time was president of Sloan Kettering, su suggested I do an investigation of William Kelly, who was the eccentric dentist who was treating cancer patients with aggressive nutrition, and that's how it all started. I got interested in nutrition and went on an alternative path and had two different offers for jobs at Sloan Kettering, both of which I turned down because they would have required that I do more conventional research. I mean, I was honored that my professors, years after I graduated, thought I had promise as a basic science researcher, but I wouldn't have had to give up the nutritional work. But my intent initially was to do basic science at Sloan Kettering the rest of my career. That's why I went to Cornell.
So you've kind of seen both sides then, the more traditional medical doctors and ones that
I
can
was
employ alternative therapies.
I was trained very conventionally. I mean, my mentor, my research mentor, Robert Good, was one of the preeminent cancer researchers in the conventional academic world. He did the first bone marrow transplant in history. And under his tutelage, while I was doing my fellowship under him, I learned how to do bone marrow transplants, which is about as conventional, orthodox, aggressive oncology as you can get. So I was trained to do bone marrow transplants. So that's very conventional.